KPRC is helping you become classroom ready, and that includes youth mental health. So joining me now to share more on this is Dr. Taiwo Babatope, a psychiatrist with UTHealth. Good morning.
Good morning, Haley. Thank you for having me.
Yeah, thanks for coming in. So start by talking about some of the common things that we see among youth right now. We've done plenty of reports about anxiety and depression, suicides all being on the rise. Is that something that you can verify you're seeing?
Yes, thank you so much. Fantastic question. Attention deficit hyperactivity disorders, anxiety disorders, disruptive behaviors, and depression are some of the most commonly diagnosed mental health disorders in kids. And we do know that estimated prevalence rates puts ADHD at 9.8%, depression at 4.4%, and anxiety, of course, at 9.8% as well.
You know, this is something that as we head back to school, I've heard personally from teachers who are very concerned about having to address these issues. They are not trained in mental health. They're trained to be educators, right? And so how can we help them better have access to mental health resources? What can we give them that can give them more confidence going into this school year when we know this is a big problem, that a lot of students are struggling with mental health right now?
Yes, definitely. We do have the Texas Child Health Access through Telemedicine services, which is called the TCHATT program.
Yeah.
And that is one of the 5 state-funded programs that we have that was developed by the Texas Child Mental Health Consortium. And it was supposed to leverage the capacity and expertise of health-related institutes to be able to address mental health concerns in schools. And it is available for students enrolled in the Texas public school systems, kindergarten through 12. And of course, as we all know, early diagnosis and access to treatment is very important. And TCHATT, which we call it, is an avenue to be able to address systems of care in the state of Texas.
Who is TCHATT available for? Is it just the school counselors who are identifying a problem with a child that can access it? Can parents, can all teachers access it?
Yes, definitely. So designated school officials such as school counselors can identify or be made aware by the parents or the teachers about this service, and they can send us referrals through our TCHATT line and definitely obtain consent from the parents before we initiate a virtual appointment.
Sometimes you can have referrals like that, you can get the resources, but you know, therapy can be a luxury for families. They still don't have good access to quality care. Any advice that you have for families who are struggling to find quality care?
That's also where TCHATT comes in, actually. We provide brief interventions for 8 weeks for therapy and also for medication management with psychiatrists.
Great.
And definitely, even if they have not established long-term access to care, we continue to support them in these programs. And our sessions are virtual. It can be accessed either at the school or in the privacy of their homes. And all you need is a laptop, PC, a safe private place, and a legal guardian or a school official to facilitate the conversation.
Yeah, which if you don't have those things at home, then you can get access to it at school.
Exactly.
So any last question, any last tips for parents and students navigating that transition back to school? What's your advice to them?
Well, I think we need to stress that many children will develop anxiety related to schools, starting schools, changing schools. And one thing we need to know is that 2 things impact the transition to school. First is preparation, and also the feelings and anxieties and the attitudes of the family towards this. Some helpful tips are to make sure that they're up to date with their well-checked visits, and also with their behavioral health visits with the therapist, with the psychiatrist. Also ensuring predictable routines, sleep, nap times, well ahead before the school starts. And of course, reaching out to the teachers to talk about their kids so that they can get to know them. I know some schools organize back to school programs and tours of the school campus.
So take advantage of those things.
Take advantage of those, and also building community, connecting with families, other families in the schools. They can carpool as well, organize play dates before schools. Last but not the least, though, is to be able to support and be reassuring to the child, to understand, to let them know that anxiety is common, but to be able to discuss some concerns, expectations, and also strategies to help mitigate some of those worries and anxiety as well.
I think this generation of parents is doing a good job of that. This post-pandemic generation of parents is talking about mental health just like we talk about physical health, and that probably wasn't something that's been passed down to every family. So I think that is one good thing that's coming in our society, and I'm proud of that.
Of course, definitely. Our parents are doing a fabulous job.
Yeah. So TCHATT, thank you so much for incorporating that. We know that teachers are identifying when students are struggling, but they don't really know what to do with it. So thank goodness for TCHATT.
Thank you so much.
All right.